Greetings and thank you for joining me for today's Innovations in Facial Plastic Surgery update. I'm Dr. DJ Verrett. Today I'd like to talk to you briefly about different types of anesthetics used in facial rejuvenation procedures. Anesthesia can involve anything from topical numbing medicine to general anesthesia where a patient is asleep and requires a breathing tube to assist with breathing. There are several different categories of anesthetics which can be used. The first and least invasive is topical anesthesia. In topical anesthesia, a type of medicine is placed on the skin. It is left for at least 20 to 30 minutes. Generally, lidocaine is used in concentrations higher than those which are injected. When topical lidocaine is used, the outer layers of skin are numbed. This type of anesthesia is good for facial resurfacing procedures, as well as some types of facial filler injections. The next type of anesthesia which can be used is called local anesthesia. Local anesthesia involves injecting lidocaine or some other numbing medicine underneath the skin. The injection can be made directly into the area which is to be worked on, or it can be placed so that it numbs an entire nerve of an area to be worked on. For instance, the nerve which provides sensation for the cheek area comes out just under the eye. This is called the infraorbital nerve. Injection can be made around the infraorbital nerve with one injection that will numb the entire cheek. Similar injections can be made for the lips, the lower cheek, as well as the forehead area. The next type of injection is called, or the next type of anesthesia, it's called intravenous sedation or IV sedation. This type of anesthesia is similar to what one would get when having a colonoscopy. A small tube is inserted into a vein in the arm and medications are provided through the tube, are called an IV. These medications will make the patient very sleepy, where the patient will not remember what is going on. They will generally sleep through the procedure, or they may be kind of in a twilight sleep. With this kind of anesthesia, no breathing tube is necessary. It can safely be administered by the physician performing the procedure. However, commonly an anesthesiologist is involved to monitor the patient's vital signs while the procedure is being performed. The most invasive kind of anesthesia, called general anesthesia, involves a patient completely going to sleep, not remembering any details of the procedure, and having to have a breathing tube placed to help breathe during the anesthesia. This type of anesthesia is administered by an anesthesiologist or one of his or her designees. This type of anesthesia does need to be provided in a very safe manner in a certified facility with all appropriate care taken to ensure that specialty equipment is necessary or is available in case of problems. These types of anesthesia can be combined for different types of procedure, and depending on patient comfort and the invasiveness of the procedure, some procedures can be performed under local while others need general anesthetics. For more information about the latest innovations in facial plastic surgery, please visit my website at www.innovationsfps.com. I'm Dr. DJ Verrett. Thank you for joining me. Have a great day.